Hello, everyone. I am Dr. Sri Banerjee, core faculty for the College of Health Professions at Walden University, and today I'll be presenting on the role of sleep duration in cardiovascular mortality among patients with chronic kidney disease. But before I get started, I want to say, first of all, that thank you to all the organizers of the British Sleep Society for organizing such a wonderful conference. With great honor that I'm presenting this topic, which has been accepted this year, and I worked on this with two of my former students who are now uh, doctoral graduates, I'm excited to say, Dr. Ubong Usua and Dr. Mary Beth Greenway. So I want to thank them for all of their contributions. Um, to start off, it's important to note that sleep is an important area that requires a lot more research and study. Typically, insomnia is seen as an issue, and so a lot of patients come into the clinic with sleep problems and a lot of awakenings. But this is focusing more on excessive sleep. We typically think of sleep, the lack of sleep, sleep deprivation as being issues, but we don't oftentimes think of sleep excess or excessive overall sleep being an issue, and this is what this focuses on. So more specifically, if you're thinking about, disruptions in REM sleep, this can cause, sometimes it can actually even cause excessive sleepiness. So people that are sleeping anywhere from 9 to 11 hours, data shows that they were 38% more likely to result in coronary heart disease. So, given these findings and some other findings that previous researchers had come up with, we decided to determine what role does sleep play in the development of cardiovascular disease. But more specifically, what we're focused on is something called cardiorenal syndrome. Cardiorenal syndrome, generally speaking, is a uh, concurrent occurrence of both chronic kidney disease and cardiovascular disease. And so, in this model, if you look just briefly under the results, the triangle, the pyramid shape, you'll see that chronic kidney disease is the independent variable, and then the outcome variable is actually cardiovascular disease mortality. So, this would be considered something called type 4 cardiorenal syndrome. And so the question that we were trying to get to, the root issue that we're trying to understand is, in fact, what is the relationship between sleep duration and type 4 cardiorenal syndrome? Or you can pose this in a different way, which is maybe more easy to understand, in that, yes, we know that there is an association between chronic kidney disease and cardiovascular mortality. This is something that has been shown. And of course, we looked at that in this population as well. But what we were further interested in understanding is, in fact, um, what if we had excessive sleep duration? Now, what would how would that influence the effect between chronic kidney disease and cardiovascular mortality? Would there be a difference if you factored in sleep duration, excessive sleep, or wouldn't there be? And so we looked at National Health and Nutrition Examination Survey. Of course, we followed up through December 2015. So um, some of the earliest respondents actually had answered in 2005. So overall, there were roughly 8 years of follow-up between initial and then mortality. So we were looking for mortality, cardiovascular disease mortality as the outcome. And of course, this was determined through the International Classification of Disease 10, ICD-10 coding system. So we had all our variables defined, and so we're trying to see, kind of initial bivariate analysis, and of course saw that lower education was significantly associated with increased cardiovascular mortality, which was of course expected. So then we went into understanding the hazard ratio applying Cox regression. And so during crude association, of course, there was a significant relationship between chronic kidney disease and cardiovascular mortality. But when we looked at how sleep influenced this relationship, there was definitely effect modification going on. So while high sleep duration led to increased hazard ratio, normal sleep was lower. So this showed that sleep, in fact, really did have an effect on the relationship between chronic kidney disease and cardiovascular mortality. How do we put it in another way? The other way to put it, of course, is that um, sleep duration has an association with type 4 cardiorenal syndrome. And Claudio Ronco and Peter McCullough, these individuals, Dr. Peter McCullough, were some of the founding thinkers in cardiorenal syndrome. So this adds on to some of my thesis work that I did. And it's important to note, especially in public health work, that it's not only important to understand insomnia in the context of chronic diseases like obesity, multiple sclerosis, heart disease, but it's also important to understand hypersomnia. So narcolepsy, um, something called, idiopathic hypersomnia. So secondary causes of hypersomnia also are chronic diseases, just like insomnia. So again, in conclusion, it is important to keep in mind excessive sleep when we're considering chronic diseases. And thank you for listening to this talk.